Hello friends, are you suffering from gap in your front teeth and don't really know what can be done? Is the front teeth gap making you an awkward situation to smile? Is it socially not welcoming? Do you really feel like hiding it, and now especially on Zoom calls and the world of internet, you always have a hand on your mouth? Is it so? So friends, today in this video we are going to discuss on 3 options on how can we close down this midline gap. Yes, we all know that braces is an option, but there are other 2 which are much more quicker. So come, let us have a look at this today's video.
Subscribe to my channel Dr Mansi Shah to get tips on dental health.
Hello and a happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr Mansi Shah. So friends, gap. Is it really abnormal in all the conditions? No. In small children below 12 or 13 years of age, this gap in the teeth is very much welcoming, because do you know that gap in their milk teeth or in the few early stages of permanent teeth, that is below 12 to 13 years of age, this gap is very much wanted, because later on the permanent teeth and the eruption of wisdom teeth and molars, they all fill this area, and this gives an indication that later on there will be no crowding and the gaps will be filled up. The next stage that comes up is the teen and the adulthood stage. In this stage the gaps are not really welcoming and it becomes really socially awkward situation. Now many people have this gap as a hereditary, that is, it runs in family. You can see that the brothers and sisters or father-daughter, father-son have having same style of gap, or the space is in the same position. So this can also be corrected with the below 3 options which we are going to discuss. It is not that you should not get this corrected, but it is a very good thing that you can always correct it. Then some people think that having space in teeth is a very good thing. If you close down this space, it will bring you misfortune or bad luck. But it is nothing of that sort, and you all know that we should not believe in all these myths. Closing down gaps can bring in a lot of confidence, can improvise your smile and your eating habits and style. So it is always better that you opt for it. Now the last stage that comes up is late adulthood and old age. So as we grow old, our bone support loosens up or it reduces, and then our maintenance is also sometimes hampered. The plaque and calculus buildup increases, our eating style changes. All these things leads to increase in the gap of the teeth. Sometimes there is just a gap of 0.5 to 1 mm, which is negligible in the early days. But then with the increasing age, this gap goes on increasing, and then it becomes really difficult. Plus along with it comes loosening of teeth and difficulty to put on and undergo many of the treatments. So what can we do to close these gaps also? So gap in any and all age. Let us not get ashamed and feel ashamed of it. We can always treat them. How? There are 3 basic options. The basic and the most important option is the first one, that is braces. Yes, braces do take a little bit longer period of time, but that is the most authentic and the most best way to get the gaps treated, because here you're permanently closing in a very natural way the gap. Yes, the way is very natural. You are just pressurizing the teeth with some force, getting them close together, and that is how the teeth, they then get stabilized into their new position. It is just like shifting from one country to another country and then getting permanently settled there. In this, you have very less chances of relapse and you have good maintenance also. So it is always the best way to have and select the option of braces if you have good time and obviously the financial support. So in braces, you have 2 options. The traditional ones, metal braces, are much more cheaper. The next option that is available is clear aligners. So in your adulthood, or when you don't really have to show off your braces, or you're not willing to wear those metal braces or the traditional ones, then you can invest a little more and have those clear aligners, when wearing these clear aligners would not tell anyone around you that you are undergoing a braces treatment. So there are these two options. You can talk to your dentist and opt for the right option. Now coming to option number 2, cosmetic filling, aesthetic filling or cosmetic build-outs. So these are really good procedure which is available, which can easily be done within 2-3 appointments, and the final procedure is done within 1 to 2 hours. Yes, within 2 hours of the treatment investment, you can have this cosmetic procedures done. So what exactly is done? Now if you have an idol, suppose imagine, and you have to increase the size of it, what would you do? You will add on more clay, right? So now imagine two teeth which have some space in between them. So if you add some cosmetic material which looks like just like your teeth, then the size of the tooth would definitely increase, but the gap would shut down. Here definitely the width or the size of the tooth increases. So hence it is very much important that you visit a good dentist and get this aesthetic treatment done, because it is very much important that how after increasing the size of your tooth your face will look. If your teeth are already large in size and you still build it up more, what will happen? Yes, it will not look good. So a proper smile drive or a smile test drive, what it is called as, smile designing what it is called as, you should have that done before you go for this aesthetic filling. So in this procedure, basically a cosmetic filling is done. The tooth is slightly trimmed off, which is very much in minute mm's, and then an artificial substance is stuck to it. This artificial substance is similar and very much polished and looks same like your original natural tooth, and it has various shades available, so it can be matched to your tooth. So in this thing, only one disadvantage is there, that you cannot pull anything or break anything from your front tooth, because it might just chip off, as in the end we have stuck something artificial to your original tooth. And also it needs a lot of maintenance, because over the period of time it might just get discolored. So in this, discoloration should not happen. You should brush it and maintain it properly. Now what if it gets discolored or dislodged, broken up? Then you can easily anytime visit your dentist and get it treated. So this is always and the best option if looking for some quick options to close the gap between your teeth. Now the third option, which I don't recommend to most of my patients, is the caps and the veneers. Yes, in certain conditions you need to have this caps and the veneers, but in most of them I don't recommend it. Why? Because when having caps and veneers, it brings in a lot of maintenance, and yes, there is a lot of cutting down of your natural part of the tooth. Sometimes you need to undergo a root canal treatment. So all these things come in, and a lot of complication and a lot of treatment gets involved when having this caps or veneers. But having veneers or caps definitely improvises much more better than the cosmetic fillings. So that is also one of the options. So if you're into a profession where your smile is the most important thing, you're opting for some auditions, some actor, actress, etc. fields, then you should think of this. So this caps and veneers basically are nothing but the artificial substances which are made into the lab and then added onto your teeth. As you can see, veneers are shells of teeth which are added only from the front. Just like your phone, you have a new cover, similarly in that way. And caps, as you can see again in the picture, that it is a complete cap or crown that we say, which is given to your tooth, and it is much more larger than the size of your original tooth, and then that is placed. This caps and veneers are the option number 3, which you can use for closing down your gap. And yes, this can also be achieved within a week or 2, depending on what procedures you exactly need. So this is also a much quicker treatment achievable than your braces treatment. But as I said, according to the options given, the braces be the first one, then the cosmetic filling, and then lastly you can opt for caps and veneers. Obviously this depends and differs from case to case and patient to patient. So discuss what option will be the best one for you, and then go for it. Friends, if you have any questions related to closing down your tooth gap and want me to help you out, then please write it down in the comment section below. Me and my team are always there to help you out. If you are liking and loving my videos, do not forget to subscribe to the channel Dr. Mansi Shah. Press the like button and share it with your friends. Wishing you all a very happy and a healthy smile. Stay healthy, stay happy, and stay over fit. Thank you.